Hello, my name is David Bradford. Today is October 20th, 2025, and we will be doing the abdomen test, abdominal test. And we are going to do a 360 of the room. And we'll begin. So we're going to first start off by taking blood pressure. As for our patient's arm, palpating for the brachial and radial arteries. We're going to apply a blood pressure cuff with the artery marker on that brachial artery, making sure it's about 2 inches, maybe 2.5 above that cubital fossa, with about 2 fingers room of snug fit. And now we are going to get our estimated systolic blood pressure by palpating that radial artery and pumping it up until it obliterates. Okay. Now we are going to take it manually with our stethoscope, pumping up 30 millimeters of mercury above that estimated systolic blood pressure, and then releasing at 3 millimeters of mercury. So about 150. All right, and now we are going to move on to inspection of the abdomen. So typically our patients will be gowned, and we'll ask them for consent to open it, anteriorly and show that their abdomen. So may we view your abdomen? Thank you. And we'll have them shield up. And we'll start with just the inspection, looking at the surface, contours, movement, see anything abnormal, looks good. We'll move on to auscultation. And we'll start with general auscultation of each quadrant about 2 times. Okay, and now we are going to auscultate our hepatic and splenic rubs. So go about mid-clavicular, those costal margins, around those costal margins on both sides, splenic, hepatic. And now we are going to auscultate using the bell side of our stethoscope for our vascular abdominal brutes. So we'll start with the aortic, renal, iliac. Now we're going to move on to palpation. Percussion actually. And we're going to start with general percussion. So we're just going to go about 2 times in each of the 4 quadrants. Okay, and now we're going to palpate for our inferior and superior borders of our liver, making sure our patient shields up and out. We're going to start in that second intercostal space, going down until we feel dullness, okay? And then we're going to go about mid-abdominal and go up to find that inferior. Okay, and that should be within 6 to 12 centimeters. And now we are going to palpate for our splenic dullness. So we're going to have our patient, shield up and to the right as we palpate, or as we percuss that anterior axillary line down to those costal margins, and then across, listening for any dullness. Now we're gonna have our patient take a deep breath, hold it. Same thing, anterior axillary line. Yep, and they can relax. We're listening for that dullness. Dullness can be indicative of splenic or enlarged spleen. So now we're gonna move on and do our kidney punch test, or yes, our kidney. So we're going to let our patient know that we'll be performing 3 different pounds on each side of their back, and if they feel any tenderness or pain, let us know. We're going to start around that T10 area, and we're going to give those pounds, one harder after the other, and getting feedback from your patient after each one. So here we go. Good. Good. How was that? All right. Left side. Good. 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 All right. Now you can lay back down. We're going to move on to palpation. So we're going to start with general palpation. We're going to palpate each of the 4 quadrants about 2 times. So we're just going to go lightly, about 1 inch in to each one. Now we're going to move on to deep palpation. So with this, we're going to be palpating a little further in, about 3 inches. We're going to let our patient know if you feel any discomfort, let us know. Also, making sure that we do this, each movement, in a counter or in a clockwise manner. All good? Okay, so now we're going to palpate for our liver. So we're going to hook those costal margins. Ask our patient to take a deep breath. Palpating that inferior border of that liver. Okay, now we're gonna palpate for our gallbladder. And we're gonna get right underneath that those costal margins. Tell our patient to take a deep breath. And release. All right. And now we're going to move on and do our two different signs. We're going to do our Robson sign, and we're going to move on and do our McBurney sign. So we're going to start at our umbilical and find that ASIS, and it should be within about 2 inches from that line across. So about here, we're going to palpate, and then we do our Robson sign on the opposite side. And now we're going to do our psoas test. So we're going to place our hand on our patient's leg and ask them to lift it. Very good. And now we're going to perform our heel tap test, heel kick test. So we're going to bend our patient's foot, and we are going to elicit a pound into the heel or the heel kick test, and have our patient let us know if they feel any pain, numbness, or anything when we elicit this. All right, you ready? Mm-hmm. Good? Mm-hmm. Okay. All right. And now we are going to palpate for our kidneys, hooking our hand right under that the posterior costal margins, and we're going to ask our patient to take a deep breath as we palpate, trying to get a good pinch of that kidney. Go ahead. All right, you're good. And we'll do the opposite side. Remember, get that hook, and we are going to try to pinch that kidney to get a feel and palpate it. Go ahead, take a deep breath, and out. There we go. And now we're going to palpate for our spleen. So we're going to reach across the opposite side, pulling up that those costal margins, and we're going to palpate around those intercostal spaces, palp around, try to see if we can feel that spleen. And then we're going to ask our patient to take a deep breath. We're going to see if we feel that spleen fall down at all. We're good. And now we are going to palpate for our aorta. So we're gonna come right here in the middle, try to, feel out each of those sides of the aorta. Should be within 2 to 2.5 centimeters. And that is our aorta or abdominal test. We're going to perform the 360. Thank you.